hello once again, viewers, and welcome to another informative show. Thank you for tuning in to Let's Talk Health, powered by Let's Move TCI. I am your host, Tamika Handfield, registered dietitian with Nutrition in Demand. Nutrition in Demand is a nonprofit organization whose aim is to raise awareness to the importance of health and healthy eating. I am excited to be sitting and sharing with you in this show, as well as all of the other very exciting and informative shows that we have planned for you. So the objectives of these shows are to start and to share current information and discuss benefits of optimal behaviors to develop and reinforce healthy lifestyle, to educate residents on establishing lifelong nutritional and fitness goals, to reduce risk of chronic disease among residents by helping viewers identify and avoid problematic behaviors, and to use the power of individual stories to understand, inspire, and improve the health in the TCI. We would love to hear your feedback, so please feel free during the show to ask your questions or your comments in the comment section below. And as always, we would do our very best to get an answer to you in a timely manner. Today, we're going to just jump right into the show. We have two very lovely, beautiful ladies who are joining us as our guests. I will allow them to introduce themselves and tell us a little bit about themselves. Ladies, your name, your career, the length of time that you've been in practice, and any other exciting information that you would want Turks and Caicos to know about yourself. Welcome.
Thank you.
We're going to start with Dr. Lana. Please tell us a bit about yourself.
So my name is Dr. Lana Bewaji. Most patients just call me Dr. Lana because my last name is a little bit difficult to pronounce. That's fine. I've been a practicing dentist since 2018. I studied at the St. Augustine campus, UA St. Augustine in Trinidad. And let me see, I'm a wife, mother of two, and I enjoy cooking. All right, that's a little bit about me.
Nice. Leanne?
Hi, good morning. My name is Leanne Higgs, and I'm a dental hygienist. Most people recognize that I was the first dental hygienist to move to Turks and Caicos in 1996.
Right.
I actually took my training in Canada. I graduated in 1986. So that really dates me. But anyways, my passion has always been dental hygiene. I knew from age 14, this was the field that I wanted to be in. I'm the owner of Proactive Dental Hygiene. The name came with a lot of thought. Proactive meaning doing things to prevent disease, not reactive dental hygiene. As far as an interesting thing about me is I started the Provo Roadrunners about 12 years ago. So believe it or not, I have run 2 full marathons, that's 26.2 miles, and easily 25 half marathons, 13.1 miles. So I'm really excited about this program. It's so great to get information out there, and I appreciate this opportunity.
Well, thank you. Thank you all so very much for accepting the invitation. I'm excited about this show because, you know, we don't normally think of, when we think of overall health, we don't normally think of oral health, right? So I'm excited about getting information out there. Leanne, you said that you knew you wanted to be a dental hygienist since 14?
Yes.
May I ask how or what got you interested in that field?
Well, it actually goes back to my father, and my dad had gum disease, advanced gum disease, which was not diagnosed by his dentist. My mom was the person who noticed it, and she said to him, your gums are red and swollen, and I notice your breath isn't as sweet as it used to be. And that's a hard conversation to have with somebody. So my dad made a dental appointment, and the dentist back then was basically old school. Take the teeth out. That's what we do. And we give you your false teeth. Dad was in his probably 40s. He said, I don't want to lose my teeth. Is there anything that can be done? And I believe there was a certain amount of, oh, he's a farmer, he can't afford this. But Dad insisted, and he was sent to a specialist, a periodontist, which is someone who specifically deals with gum disease. Long story short, my dad had to have some advanced treatment, some surgery. He died last year with every single one of his teeth, minus one wisdom tooth at age 86. So how does that tie back to me? Well, when I was 14 and I mentioned bleeding gums, my dad just jumped on it and he said, that is the first sign, and I'm not letting you go through what I went through. He actually booked me an appointment. He did the referral to the periodontist. I didn't see a periodontist. I saw the dental hygienist. Now, there I was at 14 thinking, it's a pretty easy job. All she did was put a little pink stuff on my teeth, showed me where the germs were, taught me how to brush, taught me how to floss, set me on my way. I thought, cool, there's probably going to be a lot of demand. And my nature is, I love working with people. I love motivating people. I love trying to help people. And so when it was time to look into the schooling for it, I said, what? 3 years post-secondary training for this? Just to teach someone how to brush and floss? Okay. Need all your sciences? Whoa. Okay, I'll do that. And the program that I took was actually a dual diploma. So I'm trained as a dental therapist. That was the first 2 years. And the scope of training for a dental therapist is different than a dental hygienist. And I had no interest in doing that, that part, but it was the baseline information that I needed to go on to dental hygiene, not knowing that dental hygiene had 10 positions drawn out of a hat for those 10 positions. And I didn't get in the first draw. Well, I was disappointed, but it was actually a really good experience because I had a year working as a dental therapist. And the scope of training of a dental therapist in Canada involves primarily working with children. I would see them in the school setting, and with parental permission, I would do their examinations, their treatment planning. I was allowed to give anesthetic. I was allowed to do fillings on permanent and primary teeth. I was allowed to extract primary teeth, put in a space maintainer for primary teeth, put a stainless steel crown on primary teeth. But I was not allowed to make false teeth for adults. I was not allowed to extract permanent teeth. So that year in the field of dental therapy kind of opened my eyes so that I'm not just tunnel vision only on gums. Right. And then the following year, I was accepted into the dental hygiene program and have practiced dental hygiene since 1986.
Nice. Dr. Lana, so we heard a lot of Leanne's story and what are some of the scope, I guess, of practice for a dental hygienist. So what is one of the main differences between a dentist and a dental hygienist?
Okay, so as Leanne pointed out, there is some to what she was allowed to do. So with respect to dentistry, of course, we diagnose and treat diseases related to the oral cavity or mouth. So we do fillings on all the teeth, whichever teeth, primary and permanent teeth. We do root canals, we do extractions, we do teeth replacement. We also offer preventive care, of course. So we do cleanings as well, fluoride treatments. So that is it. And the length of study is a little bit different. So we do about 2 years in medical school where everybody's together. The doctors and the dentists, everybody studies together for about 2 years. And then the next 3 years, we go off and specialize, so to speak, in dentistry. So the focus then is on dentistry instead of the broad medicine.
Right. Okay, nice. And I'm glad that you guys both touched a little bit on the length of study, so that persons know that, it's just not a walk in the park. It's a lot of work that actually go into studying and becoming professionals in the various fields that, that we are in. So let's just go ahead and jump right in.
One moment, Tamika.
So sure.
I outlined the scope of practice for me as a dental therapist, but not really what does a dental hygienist do. Back to the naming of my company, Proactive Dental Hygiene. My focus is on preventive, just as Lana touched on, with regards to helping people understand what can be done to prevent dental disease. Talking with people about preventing the loss of teeth, encouraging them to wear mouth guards, wear your seat belt, touching on a little bit with regards to diet and nutrition, with regards to not just the dental health and dental disease, but wellness. Because as we're going to talk about today, how everything is so tied together. Even the loss of a tooth in an adult, having them shifting their eating over to another side shifts everything off. They choose different foods to eat different foods. And with that can bring the onset of obesity as well. So my focus, I would screen the tissue, look around. I don't diagnose oral cancer, oral disease, but if I see something that looks atypical, all of my patients that come through my practice, I would encourage them, you need to see a dentist. If you haven't seen a dentist once a year, minimum once a year, get you to the dentist. I'm not a dentist. I'm going to help you with being healthy and checking for gum disease, screening for oral cancer, and just prevention, all of those things to be healthy.
Right.
So that's
well, what? That makes me think of another question I wanted to ask. Before we actually started the show, Dr. Lana and I were talking, and I admitted to her that, like most people, you guys are not one of my favorite places to come to, right? And I was trying to figure out, why that is. Why do people find it so difficult to go to the dentist? What do you ladies think is the reason why?
Lana, you want to tackle that one?
Well, there are many reasons, but as you said earlier, Tamika, just the sounds sometimes, it can be a little bit off-putting. Yeah. And I think it's the position of being in the chair and maybe lying back, you might feel a little bit defenseless, and you're opening, you might feel a little bit vulnerable, so to speak. And I know the sensations aren't the best, because even sometimes just to get a regular cleaning, I know I can be tense to even for just that. So I try to help my patients to feel comfortable, because I understand the feeling, because so I try my best to, it's not a pleasant thing, but if you come when you should come, the experience can be a good one. Even if you wait too long, we still try to make the experience as pleasant as it can be. But it's just a matter of conditioning your mind and understanding that what you're doing is helping yourself. You're not harming yourself, and I will encourage persons to think about your favorite place to be and just go there in your mind. Don't think about what is happening. Don't think about the sounds. Just go to your favorite place. And sometimes we play music, and, we just try to talk and have a relaxing time before we get into dealing with the issue at hand.
Right. Okay.
That in turn goes back to the prevention aspect of it, and my focus to try and get them to bring their children in early. Don't wait until the parent already knows there's a problem, because that's going to be a bad first experience. I've been in a position where now I've seen a couple of children as young as, 1 year, 11 months, 2 years, 5 months. And the one young lady didn't even have all of her baby teeth yet, but mom said, I want her to have a good experience. So I really work on for their first time to come in, that it's fun. They do a hands-on orientation. I let them squirt with the water squirter, squirt with the air, use the little vacuum cleaner, ride them up and down in the chair. And if there's any resistance at that point in time, I go, okay, good. And we'll see them again in 3-4 months and try again. So that every time they think about it, it's a better first impression, lasting impression. I actually had one little girl had a meltdown just outside of the clinic because she didn't get to have an appointment and her sister had one, and her mom saying, oh no, people are going to think she's crying because she doesn't want to come here. I want to see Miss Leanne. So just that conditioning, just exactly what Lana said, conditioning, starting it at an early age.
Yes, I think that's so important. I wish I had somebody like you when I was younger. Would have made my dental experiences so much easier. But yeah, as I was going to ask before I got sidetracked, is it fair for us to say that the mouth is the gateway to good health? Let's start with Dr. Lana. If you think so, please explain.
Yes, I believe that it's fair to say that in more ways than one. So you can look at the aspect of what you put inside your mouth, right? As the gateway to good health. But also a lot of things show up in the mouth. Sometimes they show up in the mouth first, right? You don't even know that something else is happening in your body, and you come to us and we say, hey, this doesn't look as it should. When was the last time you saw your doctor? When was the last time you had your blood work done, and so on? So sometimes coming in can definitely alert you to realize that your health is not really on track, even though you might feel like everything is fine. So yes, I believe it is fair to say the mouth is a gateway to good health.
Leanne, what do you think?
Oh, I totally agree with everything that she has said, because there's been times where I've been treating a patient and they're doing everything they can as far as good oral hygiene, and yet the gums are still bleeding. And it's at that point in time, I mean, we have to work together with other healthcare providers. Patient like that sent to the doctor to do blood work can find things like leukemia, underlying health issues. And I want to relate a story of a gentleman who has diabetes. And he came to me and said, I just can't get my blood sugar numbers stable. And I said, okay, you're working with your doctor on this? And he said, yes. And, I phoned the doctor to find out if it was safe for me to treat him based on what blood sugar levels he had told me. He said, go ahead, that's fine. But when I examined his mouth, it was so obvious that there was a tooth that was abscessing. It was draining pus, and sent him to the dentist, who in turn, of course, took the x-ray and confirmed, yes, it was an abscess, and gave him antibiotics, treated the abscess. And guess what? His blood sugars stabilized. And he came back to me, oh, Miss Leanne, I didn't have to change my diabetes medication. So often for patients like that who have underlying health issues, I prefer to see them more frequently, on even as often as a 3-month basis, just to assist them with keeping the bacterial level low, to prevent disease. So I don't know when we're going to get into how many dental diseases are actually tied to oral health, but
it's coming.
Okay, I have one other thing to make people think about. A patient can show up at a dental office with a specific problem, but that same specific problem, their chief complaint, could also be presented at the doctor's office, at a pharmacy. Say, for instance, patient's chief complaint is bad breath, halitosis. Okay, so they come to the dentist about this. The dental clinic has made sure there's no tooth decay, there's no infection in the gums. Patient's still complaining about bad breath. At that point in time, then I would say, you know what, let's go to your oral or your medical provider, see if there's something like a post-nasal drip. Is there infection somewhere in the sinuses? Whereas this same patient could be at the pharmacy, got bad breath, need a little bit of, give me some Listerine, and masking things. So
basically over what the real problem is, yeah?
Right. And it's so good to have an excellent rapport amongst all the healthcare providers, and to realize that not everybody can cure everything in their one place. We need to work together.
Yes, totally. So then this leads me to a story that I found on the internet. And I at first when I read it, I mean, I got it from a reputable source, but when I read it, I was like, oh my goodness, that's a little bit far out. But based on what Leanne and Dr. Lana both have said, it's maybe not so far out. So I'll go ahead and read that story to you guys, and then you can give me your feedback, yeah? So it says, when Joanne, now 50, visited her dentist for a broken tooth from chewing on ice, she had no inkling that her overall health was in jeopardy. She was so consumed with work and family that she often ignored her own well-being. But her dentist took one look at her mouth, noticed multiple tooth fractures and rapidly advancing gut disease, and surmised that she had an underlying health problem. Those were red flags that something was not right, says her dentist. Joanne's dentist urged her to see her primary care doctor to get to the root of the problem. She was diagnosed and treated for high blood pressure and anemia. 5 months later, she suffered a massive heart attack. So when I read that, I was like, wow, but I want to get into some of the conditions that can be linked to oral health. Let's start off with Dr. Lana and then Leanne.
Okay. So this, of course, is a broad topic.
Right.
But there have been studies that actually show that persons who have poor oral hygiene have 2 to 3 times increased risk of having a heart attack, stroke, or some other cardiovascular event, right? So the story that you read is definitely not far-fetched. You have a pregnant lady. So during pregnancy, the hormones that you're producing sometimes can affect your periodontal tissue. So the periodontal tissues are the structures in the mouth that support the teeth. These hold the teeth in place so that you can speak and eat properly without everything shifting about. But during pregnancy, the hormones can affect this. So some persons may experience more bleeding gums and so on. So it's important that pregnant women go and see their doctor, their dental hygienist, their dentist, even if you want to wait until the second trimester, which is usually kind of the best time to do your treatment. Just to touch upon to some specific diseases that affect the oral cavity. So the main one that everybody knows about is tooth decay. And what that actually is destruction of the teeth by action of bacteria. So your bacteria will eat sugars and produce acid, and that acid will lead to decaying of the tooth. Now, this is not a process that it doesn't have to go that way, right? So the bacteria in the mouth is usually in plaque. So you will hear persons talking about needing to remove plaque. So the bacteria is inside the plaque. Unfortunately, our teeth, they don't shed. So when the plaque gets attached to the tooth, you have to remove it by brushing, flossing, coming in to see a dentist, your dental hygienist, so we can remove that. And also sugars. So you need to watch how much sugar you're having in your diet because the bacteria like to feed on sugars. And also time is a factor. So those three things go hand in hand: bacteria, sugar, and time. So if you come in a timely manner, then the process we might be able to stop the progression of the tooth decay, or we might be able to fill the tooth decay before it becomes something too serious.
Right.
Next thing, periodontal disease, of course, as I mentioned before, what your periodontal tissues are. And as Leanne mentioned earlier, the first sign is usually bleeding gums. And I think I remember Leanne posted something on Facebook where she said, if your hands were bleeding, that yes, if your hands were bleeding, you would, while you're washing them, you would make sure that you go and see your doctor. Absolutely. And it's the same thing for your gums. If you see bleeding, that's not something that should be happening. So that is usually the first sign. Now, if you ignore the first sign, it leads to something more serious. Right. Fortunately, gingivitis, as we call the bleeding gums, that can be reversed. But once you lead into periodontal disease and you start having that bone loss and that the gums start to recede, unfortunately, that's a process that we cannot reverse, but we can stop it in its tracks once you come in and get the treatment that you need. Another thing is oral cancer. Now, most times you go into the doctor isn't going to be looking inside your mouth. But something could be going on in there. Even though you're brushing and you think you're aware of what is happening in there, sometimes you don't know. And just coming in and we might see something suspicious. And it's very important that we catch these things when they're in their early stages so it can be treated. Right? And especially for persons who are at a higher risk, if you smoke and so on, please come in, get seen so that we can stop anything or we can start to treat anything that we see happening. Yes, so.
I want to piggyback really quickly onto something that you said, Dr. Lana. One of our earlier shows we were talking on nutrition, right? And you mentioned sugars and how they affect the teeth, right? What I also want to add here is carbohydrates, right? Because when carbohydrates are eaten, they are broken down into sugars, right? So we're not only talking about candies or sodas or something that you may think is sweet, right? We're talking about the normal carbohydrate foods as well, like rice and potatoes and cassava and bread and whatever else, pasta, right? So when you eat those foods are broken down in the body into sugar that the body can use, right? That's how the body gets the energy that it needs, right? So it's important to brush and floss, at least minimum, and you guys are the expert, but at least minimum twice a day, in the morning and at night before going to bed, so that when you eat, that bacteria doesn't have food or it's not being fed, right, over the night, right?
Yes. And especially just to make a point, when you're sleeping. So normally when you're awake, your saliva is there helping to keep the mouth clean. Yes. When you're sleeping, your salivary flow is basically non-existent. So it's not helping to flush and keep clean. So whatever you eat will certainly sit on the teeth, and the bacteria will have a grand party in your mouth. Yes, that is true.
They will have a party for real. Leanne, you want to add to some of the conditions that can be linked to oral health?
What you were just talking about now with the nighttime and the saliva flow being reduced makes me think about how many people have sleep apnea and are sleeping with their mouths open, and that dryness itself is an issue. Back to what Lana had said about the saliva being able to do some of the cleaning, but with reduced saliva flow with sleep apnea or as side effects of medications and the dry mouthing, what we would offer to prevent would be a fluoride treatment to harden the enamel, or suggest fluoride varnish, or maybe a fluoride mouth rinse, back again to preventing. But then you would also take a step back and say, okay, if this patient is dealing with sleep apnea, they need to go back to their primary care person and deal deal with that.
Right.
Other diseases, when she talked about pregnancy gingivitis, there's that same hormonal thing can happen in puberty. You know, you can have gingivitis flare up in puberty. It can also affect ladies' pregnancy to the point of actually preterm delivery of babies if the oral health isn't kept up to par. I did a course online and it was talking about systemic diseases and oral health. And they gave a sample of a lady who had 8 miscarriages.
Wow.
8 pregnancies that ended in miscarriage. And she finally, someone directed her to a practice that was more proactive, where they actually cultured the bacteria in her mouth. Realized she was very high in a particular strain, big long C something, blah, 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 fancy name, don't remember it. But anyways, she was very high in that particular strain of bacteria. So once she got pregnant for the 9th time, this office said, the minute you know that you're pregnant, we are going to do a monthly dental hygiene appointment. She delivered after 9.
Wow.
That was the 9th time. So that to me was just wow. Does she love her dental office?
I'm sure she does. I'm sure she does. And I mean, I am hoping that our viewers are seeing the importance of, you know, having a good relationship with your dentist as well as your dental hygienist. You know, we're going to take a quick break, but Leanne mentioned medications. And so when we come back, I want to touch a bit more on medications and how they may or may not affect our dental health. So listeners, don't go anywhere. We'll be right back. And remember that you can always write your questions or your comments in the comment section below. And as I said before, we will do our very best to get you an answer, a factual, credible answer in a timely manner. So we'll be right back. And welcome back to our show. We have been having a wonderful, informative talk. You are tuned in to Let's Talk Health, powered by Let's Move TCI. And I am joined with our guest this morning, Dr. Lana from Paradise Smiles, and Mrs. Leanne Higgs from Proactive Dental Care. We have been, as I said before, talking about oral health and how it affects our overall health. And they have been giving us a wealth of information. And before we went to the quick commercial break, Leanne touched on medications. Now, we know, ladies, that there are many people on various medications. You touched on dry mouth as being one of the side effects of some medications. What role, if any, does medications play in our oral health? Leanne, you want to start with that? And then we'll have Dr. Lana join in.
Actually, I'm going to defer this one to Dr. Lana.
Okay, sure.
Okay.
Dr. Lana?
Right. So medications, as was mentioned earlier about dry mouth. So yes, that is a side effect of some medications. And of course, as we mentioned earlier about having the saliva flowing and helping to keep the mouth clean. So you'll find that some of these patients may have multiple cavities because of the dry mouth symptom from the medication. That's not the only symptom. Some medications also cause like an overgrowth of the gums. So you will inspect these patients and you'll discover that, well, the mouth is fairly clean, but why are the gums looking inflamed and red? And that is why it's very important when you see your patients, we're supposed to take a detailed medical history to make sure we know exactly what conditions the patient has that have been diagnosed and, you know, they're having treated by a physician, and the list of medications that they might be taking, because sometimes too, we have to prescribe medication as well. So we have to make sure that we're not giving you something that is going to interact with something that you're already taking. We also have to be mindful, some medications you might have to stop if you're going to do a particular type of treatment. Usually these are the blood thinners. So yeah, so we try to make sure that we are aware of what you're taking. Sometimes I know persons are wondering, why are you asking me all these questions? But
Right.
it's just to make sure that we offer you the best care.
Right.
Actually, for us to prescribing medications, it's more it's better for us to do the treatment versus having to prescribe the medication. But usually if the person comes in and it's an acute condition where the person is in pain, we might prescribe some antibiotics and painkillers. But the better option would be to offer you the treatment of the underlying problem so that you no longer have to deal with the pain.
Right. It's so important that you mentioned as well too, you know, persons may be coming in and wondering, well, why are you asking me these detailed medical questions? Again, because everything is connected, you know. I get those same looks as well, like when patients come in and I'm asking about their medication history or their medical history, because everything is connected, you know. So it's very important that our patients are honest, with us, and so that we can offer them the best treatment course. Now, the other question that I am having and would love you guys to weigh in on is, are there certain health conditions that might affect or worsen our oral health? We talked about, you know, diabetes before, and a lot of people in our community have diabetes. So are there some underlying conditions that can worsen our oral health? One comes to mind, like Alzheimer's disease. I would imagine that would have an adverse effect on our oral health. What do you think?
That's kind of a biodirectional one. You know, if there's Alzheimer's and dementia and the patient is just not remembering to take care of their oral health.
Right.
And sometimes too, even if a caregiver is trying to help them with their oral health, sometimes there can be resistance on that regard. But once again, the same course that I did on systemic disease and oral health talked about patients who had periodontal disease, advanced gum disease, when they passed away and their bodies were left for scientific research, when they actually did, can't think of the word right now, when they took cultures from their mouth and they cultured from within the brain, the same bacteria was prevalent in the mouth, as well as the person who has Alzheimer's. So it's like there's a low-grade inflammation. There's inflammation. And, you know, when you said about why are you asking me about my health history when I come in here, and I say, unless you bring them to me in a jar, I'm going to ask about your medical health history. And with the correlation between diabetes, patients whose blood sugar levels are out of control, they have a harder time keeping this oral cavity healthy. If their oral cavity is not kept healthy and clean, they have a harder time. That one's a back and forth one. With our patients who are on renal dialysis, you know, you've got to time your patient appointment time with regards to their dialysis. Patients who are taking chemotherapy, no treatment during that time, no treatment whatsoever. And I've noticed a correlation between wearing these masks and more buildup on people's front teeth, on the front side of their front teeth, which never used to be prior to this wearing of masks. People who I would look back in their records and, you know, the buildup was in this area and this area, but not around the front ones. And I think because of the mask, we're mouth breathing, we may not be drinking as much water, we're dehydrated. That's all tied into the correlation again. So
wow, I never thought about
upper
mask.
upper respiratory infections, upper respiratory tract infections. There's studies that are showing too that clients whose oral health is healthier going into a bout with COVID tend to recover quicker. And you look at a patient who has asthma, who uses an inhaler, how that affects the mouth.
Right.
You know, and talking to them about making sure after you've done your puffer to clean your teeth afterwards, or at least rinse with some water. Yeah. This is such a great opportunity to get this information out there because we're just bursting, Lana.
Yes, I'm learning so much, you know, from you guys. So I'm hoping as well that our listeners who have tuned in feel the same way. Thank you guys again for joining us and sitting and listening to these ladies share their expertise. Dr. Lana, you want to weigh in on that question? Do you think that there are some conditions that may affect or worsen our oral health?
Yes, of course, and I'm in agreement with what Leanne already touched on, and of course with the diabetes, very, very big. So persons really need to ensure that they're going in, because this is one of the things, when you come in to see me, and if you tell me that you have diabetes, I am on you, like finding out when was the last time you checked your HbA1c, what was the value, and I'm letting you know, listen, because as Leanne mentioned, inflammation, and when you have uncontrolled diabetes, you're very susceptible to infection. And we have to bear in mind that what is going on inside the mouth, when we see that it is infection, just like you would have infection anywhere else in your body, it is an infection, right? And also just to touch on, so you also have some autoimmune diseases that persons might not be aware of because they're not very popular, but persons experiencing dry mouth and they're not on any medication and they're wondering what is happening. Why is my mouth dry? And it's when they come and you're saying, you realize your mirror is sticking to the side of the mouth, you're not seeing the flow of saliva, you're noticing these things and you're like, okay, and the person says, well, you know, I'm not on any medication. And sometimes, so that will alert you, okay, maybe you should go and check out because you might have an autoimmune disease. There's one particular one called Sjogren's syndrome, which gives dry mouth, dry eyes, and lupus as well can affect your oral cavity. And as Leanne mentioned about with persons who are doing chemotherapy, transplant patients, dialysis patients, so these persons are immunocompromised. And sometimes these persons will know, they'll be aware, okay, I know that my immune system is not up to par, but sometimes they're not aware. And it's when they come and you might see what we call an opportunistic infection happening with the candida or fungi. So you're noticing, so you're saying, boy, you know, this is not something that we normally see in someone whose immune system is up and running. So yes, there are quite a few. I mean, we can only touch upon some of them, but believe me, there really are quite a few things to consider. Even vitamin deficiencies, show up in the mouth. So it's once again, very important. Everything, it's all connected. It's really, really all connected.
Yeah, it is. You're so right about that. I know we talked earlier about many persons not, liking to come to the dentist for whatever reason. And so many of us tend to wait until we have a toothache. Is that a good time? Or should we wait until we have a toothache to come and see the dentist? Or should we try to avoid that? Leanne, you want to start? You want to jump in on that?
Well, I think that's, to us, is a no-brainer. If you can diagnose it at home, then you know you're going to be going in for treatment of disease. Yeah, well, I'm all about bring them in early, get them in there young, condition them, talk to the parents about how they can help that role. So Yeah, that's definitely don't wait until it hurts. And same with gum disease. You will not get the signals of hurting. You'll get bleeding gums, and often people ignore that and they chalk it up to, oh, I brushed too hard. My toothbrush is too hard. And the bleeding gums is the first sign, but the next sign after that usually won't be until the person experiences tooth mobility. The teeth are starting to get loose. Hey, my teeth used to fit like this, and now they seem to be like this, or they're shifting up, they're looking longer. Those kind of things will be the signs. So if you wait for the signs, it's too late. Well, not too late. I mean, then you're going in for treatment.
Yes, yes. And to piggyback on what Leanne is saying. So a lot of times I've seen quite a few persons, they're coming in, the teeth have already shifted, and now they are asking for us to put braces on or to put something on that will, and you have to explain that that's unfortunately that's not how it works. So, and sometimes they end up losing some of these teeth, perfectly good teeth, nothing wrong with the teeth, but you have to take them out because there's nothing else you can probably offer at that time. Right. So definitely you don't wait. And also sometimes you'll be waiting on that toothache and it doesn't come, but you're biting on something, and when you look, a piece of the tooth comes right off and you're like, but I've never had pain. Why this happened? And you show up at the dentist. Hopefully we can save it, because not all the time we're able to save what is left. And many times I've done examinations and I'll say, you have a few cavities, and the patient will say, but no, I've never experienced any pain. This is not bothering me. But in my mind, I'm like, why do you want to wait until it's bothering you? Yeah. Let us deal with it now before it becomes a bother. Because sometimes persons will say, I don't have the time, but the toothache will make you find the time to come in. Yes. And it will also make you have to spend more time, right? Because sometimes it's not, you might need more than just a filling. You might need a root canal, and that is a little bit more costly than just a simple filling. Or you might end up with an extraction, right? And then you have to take time off from work to recuperate. So it's best to make the time before your body makes the time for you.
Absolutely. I mean, we said the same thing when we were talking on nutrition. You either, because one of the biggest complaints about eating healthier is, oh, it costs so much money. And maybe it does cost a bit more money, but you're going to pay the money one way or the other. You're either going to pay the money to buy the food, or you're going to pay the doctor to try and fix you, or the dentist to try and fix your mouth. So you're going to pay the money one way or the other. You can just choose which way you prefer to spend the money. So now I know we've talked a lot about various diseases that affects or kind of go hand in hand with oral health, but there's one more very important one that we didn't touch on, and it affects men. And I want one of you, either one of you, to just jump in and just give us a brief explanation on what happens. Lana, you want to go on with that? Do you want to take that one first?
I will give that to Leanne.
I was going to defer that one to you. Okay, might as well. The elephant is being spoken about. So the
elephant in the room. Let's just talk about it.
Yeah. I know people will wonder, how in the world are those two things related? And okay, are the rest of you all on the edge of your seat? You wonder, what are we all talking about?
Yeah.
Well, it's erectile dysfunction. And there have been multiple studies that have linked lack of oral health to lack of function. It goes back down again to inflammation in the bloodstreams. And I always said, if we really, really told people about this, there'd be so many people knocking on the door. And perhaps not using the other pills that Yeah, let's just not go there.
Dr. Lana, you want to add something?
I think Leanne covered it nicely.
But it's not a topic. It's not a topic that me as a female practitioner feel comfortable talking about that. And I'm sure that even in a medical history, I don't specifically ask the patient. I don't ask, but it could be an issue. So I would come around it in the long circle and say, you know, your oral health can affect, and then I'll this, and that, and hope that at least by planting that seed,
yes,
they will realize the connection again.
Yes, that's a good way of introducing it, you know, because it's not an easy conversation to have, right? There's no easy way, especially with us being female. There's no easy way to kind of have that conversation. So that's a great way to introduce it, like Leanne. Yeah. So now we've had it out there. We've covered it. So at least we know that there is some correlation between poor oral health and poor performance in the bedroom. So gentlemen, you may want to check that out if there is an issue. So ladies, we are coming down to the end, but I want to ask you just quickly, how can we protect our oral health so that we don't have some of the issues that you've talked about in this show? Leanne, you want to start?
Well, the first starting spot would be to work up the notion to book an appointment with a dental professional. Yes. Get an assessment and see exactly where you are. You know, draw a line in the sand and say, okay, from this day forward, this is what I'm dealing with, and prevention, following the advice. You know, there's a reason why. Well, I'm not sure. Is there a reason why I care more about your teeth than you guys care about your teeth? I wonder about that sometimes, but I mean, the information that we give, the advice that we give so freely, it makes me think about if a medical person had X amount of money for every patient you were given so and so much money, but every time that person had to come to you for a consultation, you had to give that money back into the pot. So say, every time the person comes to me with the cavity, oh, I got to give back so and so much money for the money that it was allotted to them, or a medical doctor. They'd be telling those patients, you know, that smoking is really unhealthy, or carrying a few extra pounds around, and because of that, you're going to see me for this, this, and this. We would be more proactive about it. So there's a reason why we're dispensing this information. We would rather you be in maintenance, keeping things healthy.
Yes.
Ultimately, even the dentist would love for that. That their practice just worked on keeping people healthy.
Dr. Lana?
Yes, I am so in agreement with keeping people healthy. The prevention. So we have our pillars of prevention. Oral hygiene. So good oral hygiene. So this includes what you do at home and also coming to see your dental professional. And sometimes you might believe what you're doing at home is adequate, but we can sometimes, you know, give you some pointers and let you know you're having some trouble spots, some areas that you're not doing so well, keep being able to keep those areas clean. Also, as mentioned earlier, of course, your diet. And I just want to plug this in. Sometimes people wonder how much sugar is too much sugar. So the NHS actually recommends that adults have about 7 teaspoons of sugar daily. Children 7 to 10 should have about 6 teaspoons. Children 4 to 6 should have 5 teaspoons. And children under 4, you try to avoid sugar. Right. And as Tamika mentioned, sugar isn't just the sugar that you're taking. You have to make sure that you're spotting everywhere you're getting the sugar from, right? And try to keep that to a minimum. Another pillar of prevention would be fluoride. So we recommend that persons use their fluoride toothpaste, fluoride mouthwash. As Leanne mentioned earlier, you get your fluoride treatment, fluoride varnish, right? This is all to help to strengthen your teeth, to protect your teeth. And also we do sealants as well to help to protect the teeth, right? So we have quite a few weapons in our arsenal to prevent oral diseases. So
right. And you mentioned, Dr. Lana, just now, children under 4 should not have sugar. Is that what you said?
avoid
Right.
sugar, yes, avoid it.
And I assume that's because that excess sugar can affect their baby teeth that's going to be coming in and so forth.
Yes. And sometimes persons believe that the baby teeth aren't important, but they're very important. You know, what happens in the baby stage can definitely affect what happens to the permanent teeth. Yes. Right. So sometimes patients will have this infection, an infected baby tooth, and that can actually damage the developing permanent tooth underneath that. And as well as we mentioned earlier, when you bring the child in and your first experience at the dentist, I might have to do an extraction. That's not pleasant for anybody. Nobody would want to go through that, especially a child whose understanding might be a little limited, right? So once you've started that negative experience, it's now hard to recondition the mind now to create a positive outlook of having a dental visit. So we do, yes, the baby teeth, very important. Please, parents, try to bring your children in as early as possible. And I just got a reminder too about the chewing on bones. Yes. I had a conversation with a patient just yesterday about the chewing on the bone. I know Caribbean people, we love. Yes, and I have a friend, she's an endodontist, and bones would be her best friend. Yes. So the endodontist is the one who does the root canals to help to save the teeth. So yes, so chewing on bones, your teeth unfortunately weren't meant to be biting down on anything hard. So you might end up with fractures. And once again, sometimes we might be able to save the tooth, we might not be able to save the tooth. So we all need to do what we have to do to protect ourselves. And you have been armed with lots of information. You know where to find us. So, of course, pop in and we'll be happy to see you.
Yes. Well, thank you, ladies, so very much. This has been an informative time for me personally, and I'm sure that our listeners and our viewers would agree as well. Before we go, we're at the very end. Again, listeners, please feel free to write your questions or your comments in the comment section, and we will try to get back to you. But before we go, just let the viewers know where they can find you guys. I guess your time of day, and any parting words that you would like to share with them. Dr. Lana, go ahead.
I missed the first part of the question, unfortunately.
So it was just to share with our viewers and our listeners where they can find you and your hours of operation and any parting words that you have with them.
Okay. All right. So I operate out of Paradise Smiles, the downtown office. We are located between Budget Car Rental and Rosie's Restaurant. And my operating hours, so I start working before everybody else. I start at 8. So for the persons who would like to come in and be seen before you go to work, I am available from 8 o'clock. I take the last patient at 3 o'clock. And yes, and we are also open on Saturdays. We work from 9 until 2 on a Saturday.
Nice. I came into Dr. Harvey on a Saturday, I think it was before as well.
And Dr. Harvey is nice enough. Sometimes you'll see you on a Sunday. So,
yes. Wonderful.
Oh gosh, I let the secret out.
That's right. Isn't that wonderful? You never know what can happen on a Sunday, right? And we have to deal with that pain until Monday. So
Yes.
that Dr. Harvey will see us. Leanne?
I'm located in Caribbean Place. Many people know the Financial Service Commission and Spence Security in there. So that's where I'm located. I work by appointment because I'm the only person there. But my hours are Mondays through Saturdays by appointments, usually starting at 8 a.m. The latest appointments are about 3 or 4 p.m. But once again, basing on people's needs, I've taken later appointments than that as well. I also wanted to just say something that I know about my office and I know about Paradise Smiles is with regards to the Provo Roadrunners, with regards to the protocol for COVID-19. I've discussed this with Dr. Harvey and just with regards to what is in place with regards to the current pandemic, because that is things that are on people's mind right now. So the protocol is being followed, and if we're asking you questions in advance, there's a reason why. It's for your health, it's for our protection as well. But that's all I can say.
Yeah. Well, thank you so much to you, Leanne. Thank you, Dr. Lana. It has been a wonderful time spent learning about our teeth. Yes, Leanne, you remember something?
Yes, I did. Phone number 241-9366.
Yes, Dr. Lana, what's your phone number?
946-5302.
Right, perfect. All right, ladies, thank you so much. The time has gone by so quickly. But hopefully we would be able to answer any questions or comments that our listeners may have. You can find Dr. Lana at Paradise Smiles, or you can find Leanne at Proactive Dental Clinic in Caribbean Place. Once again, I am your host, Tamika Handfield. Thank you for joining us. Until next time, guys, have a great day. Bye.